Good afternoon. On behalf of the NC Chamber, welcome to North Carolina's Road to Reopening, Aligning Health Policy and Business. I am Janelle Boyd with the NC Chamber. All attendees are muted to avoid any distractions during today's presentation. If time permits, we will answer as many questions as possible at the end of the presentation. If you would like to submit a question during the meeting, use the question and answer box. Please do not use the chat box. You may upvote the questions you most want answered by clicking on the thumbs up for that question. The questions with the most votes will be answered first. The recording of today's webinar and any slides will be made available to you via email within 24 hours of the webinar. Now, I would like to introduce Kelly Fuller, President of the NC Chamber Foundation. Kelly.
Thank you, Janelle, and welcome to everyone today. I am particularly excited about today's webinar. You're going to get to meet two people that I happen to know, and you will just find them fascinating, and I think the constant dialogue that you'll hear between them is going to be great. First is Dr. Mark McClellan. He is director of the Margolis Center for Health Policy at Duke University. He also is a professor of business, medicine, and policy at the center. And Dale Jenkins is the chief executive officer of Curi, the premier provider of services, products, and experiences for physicians and those who support them. So these two will present both the health side of the equation and the business side of the equation, and we just look forward to hearing their dialogue. So with that, I'll give it to you, Dale. Thank you.
Thank you, Kelly, and thanks to all of you for being on the webinar. Mark and I appreciate the opportunity to spend a few minutes with you today talking about various issues associated with COVID-19 and certainly the environment that we find ourselves in. We're going to kind of use a tag team approach. I'm going to start with some comments, sort of giving my perspective from the business community, what I think many of you are saying in the business community, the way you're feeling these days. And then Mark is going to come and do a presentation on sort of a path forward for North Carolina. Following that presentation, he and I are going to have sort of a fireside chat, kind of asking each other a few questions that we think are top of mind for each of you. And then finally, we'll give you a chance to ask some questions of your own in just a few minutes. So clearly, there's just simply no single word or series of words that can describe where we find ourselves today. You know, just 2 short months ago, business in North Carolina was booming. It was healthy. It was robust. Most of us were optimistic. We were seeing growth opportunities for 2020, and things looked pretty darn good. Now, as I've talked to many of my business colleagues, it's a totally different picture. We've all experienced some significant declines in revenue. Many of us have seen revenue declines of double digits. Some have even seen revenue shrink to zero. We were beginning to worry about, survivability in some sectors of our economy. I think all of us in the business community, for sure, we agreed with, the initial objectives that we had when we started thinking about battling this virus. Certainly, we wanted to minimize deaths, and we certainly understand the need not to overburden the healthcare system. Those were very important objectives. I don't think anybody in the business community has had any qualms with those at all. And I think so far we've been pretty darn successful. If you look at what we've done in North Carolina, we're the 9th most populous state. Our mortality rate, though, is per capita is 38, and that means higher is better. We've not come near exceeding any capacity within our healthcare system. If you look at hospitalizations, they are, trending. They're still trending upward a little bit, but they're still very manageable. I think I saw it was a little over 550 today in the hospital with COVID-19. But in many ways, I think we've had a successful 4 weeks. But I think right now what I'm sensing is that there is a restlessness and an anxiety creeping into the business community, and there's a sentiment that it's time to sort of restart. That this is going to be with us for a while, that we've got to figure out a way to navigate and reopen businesses until we get a more permanent solution, perhaps through a vaccine down the road. We know, though, that we can't just sit back and flip a switch and everything return to normal the way it was pre-COVID. Certainly, we're all concerned about safety. We want to make sure that as we return to opening our businesses, that we have measures in place that certainly are sensitive to the health of our coworkers, the health of our our customers. That is paramount in every business's mind. And so we know that there are going to be some inconveniences, and there are going to be things that we're going to have to do that are going to be necessary if we're going to successfully reopen and do it in a smart, thoughtful way that protects employees and customers. So we're beginning to advocate. There's a lot of movement in the business community I'm in to start advocating that we look at a variety of things, and Mark is going to touch on some of those in just a few minutes, but things like looking at exploring, loosening up things from a regional perspective. You know, North Carolina is a big state. We've got 100 counties, you know, and what's happening in the east and the west is very different than what's happening in the Piedmont, in the major metro areas. So can we look at a regional approach to reopening North Carolina? You know, the other thing that we're advocating is beginning to look at certain population groups. It's no secret that the most vulnerable population with respect to this virus are elderly people, those that are perhaps 65 or older. They've got comorbidities. Obviously the nursing homes, the prisons, those places are hotbeds. So target specific groups of individuals as opposed to having sort of a one-size-fits-all policy for all North Carolinians. And then we're advocating the promotion of what I'll call best practices. The chamber is working on a project, I know, to sort of accumulate some of the best practices that businesses can use to make sure that when employees do return, they do so in a safe and wholesome environment. So things like social distancing, wearing masks, you know, making sure we're sanitizing, you know, surfaces routinely. Mark is going to talk on testing as well. How do we do testing, and how do we make sure that we're doing that appropriately, and what do we do with the test results when they come back? And importantly, if we do those things, a lot of businesses are asking, how can I get liability protection? You know, I don't want to be sued. You know, if I open my doors and I do everything possible to keep my employees safe and healthy, then how do I avoid a lawsuit? So, in short, businesses are eager to be part of the process. We want to be at the table, helping policymakers, helping medical experts make decisions relative to the best way to reopen North Carolina. We want people to listen to business. We want people to trust business. We want to help accelerate the reopening, and we want to be part of the solution. So that's sort of the perspective I'm hearing, Mark, from the business community. Why don't you take a few minutes and sort of walk us through some of the issues that you're seeing from sort of the medical and business perspective from your world. Unmute. Mark, unmute.
All right, can you all hear me okay? Right. Dale, I'd like to thank you for the opportunity to be here. Kelly, Gary Salamito, you know, we've had at the Duke Margolis Center for Health Policy some ongoing collaborations with the Chamber. So it's good to be back with many of you today. For those of you who I haven't met before, our center at Duke is a university-wide program that also has offices in Washington, D.C., and we work nationally and locally and globally, for that matter, on practical solutions to important problems involving the health of our population. And you know, with the situation we're in now, I think Dale said there are just no words to describe. I mean, unprecedented doesn't even come close to doing it justice. And so this kind of partnership between the Chamber and local businesses and the work that we're doing to try to identify a path forward and make progress is the kind of practical approach that I hope can help make for a successful recovery here in North Carolina, and a model that we can use elsewhere around the country. So it's a pleasure to be with you all today, and a pleasure to be part of this ongoing collaboration with the Chamber. I'm going to try to cover several topics. We'll go to the next slide around reopening. first provide a little bit of an overview of the context that we're in now, and then definitely make it specific to North Carolina, and also spend some time on what's happening around the country. There are some states that have started to reopen already. There has been some guidance and frameworks developed, including in part by us, but also by government agencies, CDC, and the White House, that are very relevant to taking steps forward. And while North Carolina isn't reopening yet, this is a state that I think can benefit from some advanced planning, and especially leadership and engagement from the business community to help open successfully as soon as possible. And I'll talk a bit about that too, and look forward to some time for discussing these topics as well. So if we go to the next slide, there are two big problems that we're trying to deal with. The first, as Dale eloquently stated, is the worries about overwhelming our health system, and the worries that people have that they just can't go out and be safe, and especially have their loved ones be safe, their parents, people with those chronic conditions that are very common in the state and around the country. And so we've seen some extreme steps to try to limit the spread of the virus. And they've been successful. And North Carolina actually benefited, I think, from acting relatively early compared to the number of cases present in the state. That's kept the total case level low in North Carolina compared to many other places. And that's why we're doing so well as a state in terms of those national statistics around deaths and the health impacts of the pandemic. But obviously that's led to some serious consequences for our lives and our economy. So we want to find a way to move forward from this. It's not going to be the old normal, as Dale said, but there are a growing amount of experiences, evidence, and the like that can help make for a successful path forward. And I do want to emphasize that public-private collaboration, especially with private collaboration led by the business community, is a really important contributor to success from here on out. It's not going to happen overnight. It's going to be gradual, but this collaborative approach is the best approach for successful reopening. And so I'll get to that too. On the next slide, I just want to spend a minute on the big picture here. And, we've got a ways to go, but I want to give a bit of a sense for optimism, and we are going to get through this. The way that every pandemic starts is at the top left of this chart. By definition, this is an infection, a viral infection that doesn't have any known treatment. So the only things we have to offer, the only things we can do to slow it down, are the non-medical interventions. And you all may recall previous epidemics, bad flu seasons, flu pandemics like H1N1, SARS back in 2003 when I was working at the FDA. This is not the first pandemic. It will definitely not be the last, but it is the worst that we've had in at least a century. And so the usual measures that people take, like some more limited distancing steps, maybe closing some schools or businesses in regions where there are outbreaks, maybe taking some steps for older individuals to do more sheltering. We've done the most we possibly can on just about all of those dimensions because of the seriousness of the pandemic. I know people are wondering about, just how fatal is it if there are so many undetected cases? Well, the flip side, if the fatality rate from COVID-19 is not that high, what that means is that the transmissibility is much higher. So the ends up that the burden on cities and communities and on the country is much larger than, say, for a flu or even a very bad, even any of these other pandemics that I've talked about before. And that's why we're seeing such extreme responses. And with the first cases came this surge that we're now starting to come down from or leveling out from, where, as you saw in many parts of the country, really horrible situations where hospitals were full, healthcare workers were stretched to the limits. We were worried about whether we'd have enough ventilators and protective equipment for our healthcare workers to manage the pandemic. And fortunately, we seem to be coming through those surges because we've taken these extreme steps early. So what happens after that is that we start getting better when medicine starts coming through. We already have better diagnostic tests available. They're becoming more available, just like the surge this past month was in making sure we had hospital beds and ICUs and ventilator capacity. The surge right now is making sure that we can make diagnostic tests and the swabs that are needed for sampling and the materials that are needed for performing the lab tests available quickly and widely. And the state, just like every state around the country right now, is engaged in a hopefully rapid process for getting situational awareness of where testing is needed, making sure that all the materials for the tests are available and that people can find out about how to get it and get their test results and share the results, especially for positive tests, which need some steps for containment afterwards. So I'll talk about more in a moment, to make sure all of that can happen around the state. And this is an area where healthcare organizations like Duke University, UNC are collaborating with building out this capacity, CommuniCare of North Carolina, other partners for the state to do this so-called testing and tracing of contacts. That's going to be very important in this next phase in not just responding to the surge, but containing further outbreaks. Looking ahead, I think we're going to have better tests, tests that can potentially be used more easily at the point of care. They're in development now. They're not as sensitive and as accurate as we'd like to have, given the seriousness of the pandemic, but they're getting better. And we're getting a higher volume of these tests so that people who do need them can get them more quickly. Not there yet, but making a lot of progress. And then, of course, the whole ball game is really about effective treatments. And you've probably heard a lot, including just in the last couple of days, about progress on the ultimate treatment that's needed here, vaccines. So that'll give us broad immunity in our population and really prevent further damage and further impact from the pandemic. That's still a ways off, although there are some unprecedented efforts underway to speed up the process. Not, I think, by cutting corners and making sure that a vaccine treatment is safe and effective. That does take some time to develop, and you need to make sure it's safe because you're going to be giving it to a lot of people who are healthy, and you need to make sure it's effective. So you have to wait long enough for people to develop an immune response, and that takes months. But a really remarkable thing that's happening now is investments in the capacity to manufacture lots and lots of doses of the most promising vaccines while all that testing is going on. So there's not this long waiting period after the treatment is developed to make it available widely. And these are manufacturers working with the government, U.S. government, and other governments to go at risk, so to speak, for manufacturing. They make hundreds of millions or billions of doses of vaccine that we end up not using because it doesn't work. But if we do that with 4, 5, or 6 vaccines, think of it as multiple Manhattan projects underway at the same time, we can shave months off the availability on a widespread basis of vaccines that can really work. All that said, we're still a ways off from effective vaccines. In the meantime, there will be treatments that make a difference. There was some news just yesterday about remdesivir, which is an antiviral drug. It slows down the progression of the virus in people who are infected. It's not a slam dunk. It's not the only treatment we're going to need, but you all may remember for other viruses like HIV, we started out with a drug that helped. It didn't help everybody, wasn't a complete cure, but it was a basis for learning more about other treatments that could work. And I think that's the same thing that's going to happen here. In addition, there's a lot of treatments in testing right now that are designed to help with the most severe cases, those deaths that are occurring, especially in older individuals and people with comorbidities, with chronic diseases, where if we can reduce the severity of those cases, the strong immune reaction that seems to be contributing to the poor outcomes, we can take an important edge off the pandemic and make it not quite so burdensome and so devastating for our populations, especially older individuals. And then there are a lot of treatments being developed based on antibodies, not only antibodies from people who have recovered, but now synthetic antibodies that can be made using monoclonal antibody techniques. This is relatively new. It worked for Ebola, and a lot of those in development as well, maybe available as soon as the fall. So lots more to stay tuned in the area of effective treatments that I think will start making a difference in the months ahead, making the impact of of the pandemic less burdensome. Of course, in the meantime, there are huge impacts on all of us from the pandemic so far, and that's why the economic responses, the health responses, paying attention to personal well-being, the impact of social isolation and lack of access, especially for our more vulnerable members of our populations, are really important to take care of as well. That's why we've seen 4 stimulus bills and counting from the federal government. North Carolina legislature is passing some assistance. Hopefully that assistance can become less just in the form of filling in the holes that are created by the huge economic impact of the pandemic, but also can help us build. So as we get more resources pumped into our economy, keeping in mind that businesses are going to reopen differently. They're going to need to make investments in new ways. Our healthcare system is going to need to deliver care in new ways. We don't want to go back to the way things were just a month or 2 ago to account for the fact that we're now living with the virus for a while. So that's an important part of policy as well. And I think you'll continue to see some developments in that area. And it's an area where the business community, I think, can be really helpful in thinking about not only how do we fill the gaps, how do we build a stronger North Carolina for the future, one that is strengthened in terms of being able to use internet and other capabilities, ones that businesses that are more protected against spreading the virus and so forth. So that's some context for all of this. If you go to the next slide, we've done a series of reports from Duke, as well as this report from in collaboration with researchers, the American American Enterprise Institute, and other leading researchers around the country on how to reopen. And I want to emphasize that this is a phased approach. So in the phases that we're starting to go through now, we'll move from these extreme steps of social distancing towards less social distancing and some limited reopening. And in this report, we highlighted several dimensions to watch to show that we would be able to do this successfully. That includes a sustained reduction in cases. It includes hospital capacity, hospitals that aren't facing crisis levels of use. And it includes, very importantly, appropriate testing and the ability to trace contacts, so that as we move from everybody taking extreme measures of isolation, as we move away from that and have less isolation, there will be cases that occur. The virus is still out there, but we want to be able to identify those proactively and then work to wall them off, to identify the contacts of people who tested positively and snuff out any further big outbreaks, so we never go back to anything like what happened this past month in the United States again. And then with the better technologies coming along for treating COVID-19, ultimately a vaccine, we will get there, hopefully sooner rather than later. We can move back towards a new normal, one where I hope we keep in place systems and protection so we don't ever go through this again. So we're kind of at the end of the beginning of this process through this initial surge and looking forward to how we can reopen successfully and sustainably. What won't work is trying to take off all the brakes, going back to where we were before, where we know that the transmission rate of the virus is about 3 people or more for every person that's infected. That's just going to lead to a repeat of what happened before. So we're looking for ways to reopen that keep that reinfection rate, the rate of spread, down below 1 or so that we're not seeing an increase in the number of cases. We're at least sustaining where we are, and ideally keep that number down, and especially keep it down, as Dale said, for people who are most likely to have serious consequences from a coronavirus infection. So if we go on to the next slide, just kind of thinking about where we are in North Carolina in this process. So next one after this. We have seen an impact on our health infrastructure. We have been able to deal with the surge by shutting down early, by taking these distancing steps before there are a lot of cases in our communities. The surge has been way suppressed, and we've flattened that curve a lot. We're still having some continuing cases, but not at a level that's threatening our healthcare systems. Along with this, we need to start responding to the impacts on both within health and in our broader economy, that a lot of people have put off health services they need, just like they put off other services they need, retail services, and other things they enjoy doing, restaurants, and getting out in the community. Huge impacts of that, and those are the ones that we're going to try to address in this next phase. Go on to the next slide. So where are we now? Well, remember, one of the criteria that our report and more recently the White House framework has emphasized is a sustained decline in the number of cases. And that's not quite the case in North Carolina yet. We certainly flattened the curve, but along with flattening, it's kind of drawn out some. We've seen some continued steady levels or some increases in use of hospital beds, as Dale mentioned, but we're fortunately well below the capacity level of our hospitals and healthcare organizations around the state and treating COVID-19 and even having some surge capacity beyond that. So that's good. I think it would be better if these cases were on a downward trajectory, but as I'll get to in a minute, some other states have started to reopen, not quite getting there, particularly states that have low case rates, so relatively low levels of COVID-19 activity in their communities, and have significant excess capacity. I would add to that the importance of having the ability to test and contain any further outbreaks that occur, or again, you'll just see a curve that's been delayed go right back up. So North Carolina is preparing to manage for all of that. One other point in this, a lot of the cases that we're seeing in this state, just like other states around the country, especially the serious cases, are occurring in settings where there are a lot of older individuals who are vulnerable to COVID-19 together. So think nursing homes and assisted living facilities. Fully in the state of Maryland, for example, fully half the deaths in that state have been in nursing homes. So what many states that are starting to reopen are doing is taking some more extreme measures to protect those populations against COVID-19 spread. And that includes the kinds of steps that I've just described, just to an even higher level. So things like regular testing and extra distancing measures and protective measures for people who are at higher risk, so that even if you still have a steady stream of cases, they're not cases that result in as many hospitalizations or deaths. So, next slide. Testing, as I said, is very important. You know, North Carolina is getting there, and this experience is very emblematic of what's happening around the country. We have definitely increased our testing capacity in the United States. More hospital labs have come online, have increased their capacity for doing so-called PCR testing. Manufacturers of tests like Abbott are getting more testing capacity out into community sites such as pharmacies and other so-called drive-through or pop-up sites for testing. Remember, for testing now, since people do have a risk of this contagious condition, need to do it with special personnel and protection. So that takes some effort to put into place right now before we get hopefully more advanced and easier to use tests. But it's not just the tests that we need, it's also the swabs for getting the samples and the reagents for actually running the tests. And working out all of those logistics together has turned out to be challenging for much of the country. There are some good models being developed around the country and here in North Carolina to make sure you've got situational awareness in every community with participation by healthcare organizations, community-based organizations, and increasingly pharmacies. And I think in the weeks ahead, businesses contributing to this test and trace capacity so that everybody who needs a test can get one quickly, but we're not there now. So the level of testing that's actually being done in North Carolina is short of where we'd like it to be. Ideally, we'd be testing everyone who has symptoms related to COVID-19 quickly, so you can figure out if it's a case or not, and start that containment effort, that testing followed by tracking of contacts, the contact tracing work. We'd also be doing testing in high-risk settings like nursing homes and frontline healthcare worker settings, and as we reopen businesses, some other business settings where it's hard to keep people apart. Think about like food production facilities and the like. So that's all coming, but we're not there yet. And support for these efforts from the federal government in the form of additional funding for training more individuals to do contact tracing, providing more support for places people can go if they need to isolate or go into quarantine because they may have been exposed, and they can't do it at home, maybe converting some open hotels for that purpose. These are areas where the federal government should be providing more support in the days and weeks ahead, which will help build out the testing and contact tracing capacities that are really an important part of successful reopening. And on to the next slide. So that's where we are today. Need to keep ramping up the testing and contact tracing. We need to make sure we've got healthcare capacity. I actually feel pretty good about that in the state of North Carolina, and maybe an early step for reopening is helping the healthcare organizations in the state get back to providing more of the services for people that can't be provided at home. There's some real worries, understandable worries, especially for vulnerable patients who may be having problems with their hearts, may have a breast lump or another kind of potential cancer-related condition, kids who need immunizations. All these things are important to do in the near future. So hopefully our healthcare organizations can start to reopen. And that's an early part of reopening as well, being able to provide the other health services as well as having some surge capacity for COVID-19. And business communities are going to be a really important part of doing this successfully. As I'll talk about in the next few minutes, there are a lot of things that businesses can do to reopen and not get back to a full normal, as Dale was saying, but to follow some emerging best practices, guidances, and the like, so that they can reopen successfully, so we can have less social distancing, but do it in a way that is not going to lead to a significant increase in the transmission of COVID-19 cases. Next slide. Schools are challenging to reopen. One of the priorities nationwide and here in the state is getting childcare back open and at least the earlier grades of schools. Not going to happen, I think, this academic year, but there are a lot of good guidelines and increasing experience around the country in how childcare programs and the like can be reopened successfully, including with, even for kids, a bit more distancing and attention to some other steps that I'll be describing. The good news about COVID-19 is that it does not have much, if any, effect on children who are otherwise healthy. That's in exact contrast to conditions like influenza, which are more serious for younger people in many cases than they are for older individuals. But because there may be transmission from workers at these facilities, from the kids to people back at home, especially those at higher risk, some extra precautions need to be taken since the children will be closer together. And we're working through how to do that right now. I do think there are going to be opportunities for at least some limited reopening of childcare programs, and if not school this summer, maybe some summer programs, outdoor programs for kids that could be done in a way that protects against these kinds of spreads. So more of that coming in the weeks ahead too. Next slide. And just to focus in before I wrap up on some of the best practices for states. So next slide, for best practices for businesses. There is a lot of guidance available on this now. What's summarized on this slide came from work by the Centers for Disease Control, OSHA, and with respect to Dale's comment earlier about concerns about liability, I totally appreciate where that's coming from. You know, there is a virus out there and there is a potential for spread. Following the best practices identified in federal guidances like the ones I've described are a good way to both limit the risk of transmission and have a strong foundation for the steps that your business is taking. So it's not going to be business as usual, at least from before. For those of you who have spent time in grocery stores recently, I expect to see a lot of those kinds of practices. A limited number of people in the building, I think 20-25% of fire code occupancy levels. Distance expected to be maintained between customers wherever possible. Masks, cloth masks to prevent transmission if you happen to be carrying the virus and are asymptomatic or have minimal symptoms. And of course, for both employees and for people going out, checking every day to make sure you don't have a fever or a cough or any of the sore throat, any of the other symptoms that could be COVID-19. In those circumstances, don't go to work, don't go out. call your physician and get plugged into the emerging and improving systems for testing and managing possible COVID-19 cases, so you can help prevent the spread and help make sure we're containing any new outbreaks. Employers are going to have an important role in promoting these kinds of practices. And it also means for employees who do have symptoms, the more that we can help them out, help them stay at home without losing their job or having other adverse consequences, the better. We don't want people coming in sick because they're at risk, they're worried about their income. This is an area where I think the federal government can take more steps in providing some support for employers and for the workers who are staying home and trying to follow these best practices. There will probably be a role for testing in business settings, but at the moment, and hopefully for the future, if the rate of viral infection in the community is low, you're not going to get much yield out of doing lots of testing, daily testing or something like that on your employees, unless you're working in a very high risk setting. So nursing homes, assisted living facilities for older adults, healthcare settings, that's a different story where more regular testing is really important because the risk of having an infection, the risk of from transmitting that infection is much higher. But for routine businesses, I think these other steps are likely to be the usual approaches in the coming weeks and months. And next slide. And as I said, it's going to vary depending on kind of the degree of congregation over time for people. The more that people are together for a longer time, the bigger chance there is for spread. The more that people are touching and using or being next to surfaces and areas that are frequented by many others, the more potential for spread. So I should have mentioned before, cleaning and deep disinfection, that'll be part of the new business practices too. But for restaurants, I expect restaurants to reopen with a limited basis before bars. I expect retail stores to look a lot like grocery stores do today, and probably some slower openings for barbershops, movie theaters, and the like, although we are seeing those facilities start to reopen in other parts of the country, and we'll learn more about the risks and complications associated with that. Again, the more that people can be kept apart, the more that they're not touching surfaces that have been contaminated because of frequent disinfection, because they're not sitting together closely for a long time, the less likely there is to be transmission in the business community. And next. So states are moving ahead. Georgia was one of the first and has gone the farthest. And a lot of people are looking to Georgia to see what the consequences are. They have kind of a steady level of cases. They didn't really have a big reduction in cases when they started reopening, but you're not going to see an impact right away. So we can't just say, well, businesses started opening and things were okay the next day, so we should go ahead. Because it takes some time for symptoms to develop, because people can spread COVID-19 without symptoms, you really have to wait at least a couple of weeks to begin to get an idea of what the effects of some of these changes in distancing policies are. So we won't know for a little while what the consequences of the changes in Georgia really are. And hopefully those changes are going to be implemented in a way that contains any further spreads because of the distancing in businesses, the other business practices, and because of the other kinds of things that I've mentioned. Texas is probably the biggest state that's taking significant steps towards opening. It's starting tomorrow, and it's got some good resources, I think, that people in North Carolina might take a look at. So they've translated the general guidance from CDC and OSHA to specific guidance from the state for all kinds of types of businesses. So a couple of pages on routine business practices, but then additional steps that might be needed in restaurants or on golf courses or in other kinds of facilities as well. So some potentially useful resources there and from other states that are reopening. And next slide. Texas is also set up, it's a good example of business government collaboration, a strike force that's headed by a number of business leaders from different parts of the community. A lot of the businesses in the state have contributed to the state response too. For example, the chief of logistics, the chief operating officer for the strike force on behalf of the state of Texas, is the head of global supply chain management for Dell Computers. And so really paying a lot of attention to those supply chain and sourcing issues for things like protective equipment and test supplies and so forth. But the more broad involvement of the whole business community has given them a chance to both contribute ideas and ask questions about uncertainties that they have, has given the state a chance to provide some direct feedback and collaboration with the businesses ahead of reopening. So that's what got to a lot of those specific business plans that I described before. And it also led to a concerted effort among businesses in healthcare and otherwise, and the state, to focus on some clarity of message and continued strong protections for vulnerable populations. Texas is maintaining and enhancing its restrictions on things like nursing home visitors and staff movement between different kinds of patients or different parts of a nursing home facility, aiming for significant increased testing, especially in those facilities, with the goal of allowing some reopening while still limiting the potential hospitalizations and serious health consequences of additional cases if and when they do occur. For rural counties that may have very few cases, a lot of them, just like elsewhere in the country, they have a harder time understanding what the fuss is about for them. I have to say, looking around the country, there are a lot of rural communities, more than 80% have cases now, and a number of examples where they're not immune to the virus. They may be lucky for a while and having no case in their community, but you can have rapid spread in rural communities too. So Texas is trying to make some provisions on the one hand for the pressure that those counties are imposing on wanting to reopen, but also trying to protect them from an outbreak if they don't pay enough attention to the issues that we've been talking about. And next slide. So for North Carolina, as I said, from a standpoint of the ideal goals that we laid out in our report and that others have too, including the White House, North Carolina is not quite there yet. It's not to that sustained reduction in new cases. Like I said, other states that have reached a very low level of case activity relative to the capacity of their healthcare systems and hospitals. Some of them have started to reopen, hopefully cautiously, very gradually, and with a lot of attention to testing. North Carolina is not there on the test capacity yet, but is trying to build that up pretty quickly. And so we still got a stay-at-home order in place, but there will be at some point a phased approach for reopening. And for right now, when we aren't open yet, when these conditions aren't quite in place, when the state government's understandably not quite ready to go forward, this is a great time for preparation, for putting in place clear expectations about what different kinds of businesses need to do, for building on some of the experiences from these national guidances and from other states as to how to do this effectively, what investments you need to make in your businesses to prepare for and manage the reopening when it does occur, because it will be different. And the more of that work we can do now, while we've got this preparation time, hopefully the more this next phase in North Carolina will be like the first phase, where there's a worry that cases could really take off, that we'd see a big surge. But because we started preparing for it early and managed it effectively, that didn't really materialize. What's really going to matter for the people of North Carolina and around the country is that we are able to reopen without big risks of outbreaks. That's what's really going to slow people down from, getting back to economic activity, to have confidence they can go out and do things under this new normal set of circumstances. So it's very important to get this right, especially in the early days. And now we've got a bit of time and opportunity to continue to get ready for the next phase. And next slide, and I think we're about done. Yeah, we are done. So I want to thank you for the opportunity to start this discussion. Dale, I think we've got some time for a bit of back and forth and the like based on what we've heard from, what we're hearing from some of our participants. But thank you all very much for this opportunity.
All right, well, thank you, Mark. Very, very informative and very helpful. Let me kick it off by just posing a question to you. I've lived in North Carolina all my life. I'm very proud to be a North Carolinian. I believe we've got great businesses in our state. We've got smart people. We've got great health care. I think we've been thought leaders in many ways,
Yeah.
but we've been awfully cautious. with respect to this issue. And we seem to be lagging behind others relative to, the idea that we could move forward and reopen for business. Why do you think that has been true? Why do you think we've been so cautious? And what do you think the reluctance has been to look at the data and say, okay, we're at a point now we could be like a Texas, we could be like a Florida, we could be like one of the other states?
Yeah. Well, Dale, I think the state is headed in that direction, and hopefully it'll do it in a better way. As I mentioned, most states have still kept these these measures in place, have still kept those in place. And North Carolina, unlike some of those other states, is still at kind of a plateau in terms of caseloads and some increases recently in hospitalizations. And I know the state leaders are looking for steps like, can we get those cases down? Can we get the hospitalizations on a downward trend? I think the steps that I just described, especially focusing on high risk populations and settings, that's where a lot of the cases are turning up in North Carolina right now, not in other parts of the community, at least the ones resulting in hospitalizations. That's a good area for additional focus. The increase in testing to get the testing and contact tracing capacity up. And those are areas where businesses, at least businesses involved in those sectors, can help. I think the other thing that would help advance this process is going ahead and doing some of the work that other states are having to do now and scrambling a bit because they're doing it on the fly with short time frames to get these business practices well understood, well established, and in place. And you mentioned the work that the Chamber is doing on identifying some best practices that businesses are already starting to consider, if not implement, if they're part of the essential businesses already. Getting those well established, I think, would also help the state have more confidence. And just like you're doing with the Chamber and being strong partners with the state and taking on the big challenges here, whether economic or education or reforming our healthcare system or otherwise, I hope we can continue to make some more progress on these issues. But I hear you about the people here feeling, getting a little anxious about not moving forward faster. But we aren't quite there in some of these key metrics that I was talking about.
Yeah, well, I understand. I guess from where I sit, there's sort of the bright line in the sand is when we get a vaccine. That'll be hopefully a point.
But that's a ways off.
Yeah, where we can feel at least more comfortable, congregating in masses, similar to what we used to do. But that's, as you point out, that's a long time away. And so if we segmented the population, if we really did protect those at most vulnerable, then it just seems like we could be a little bit quicker, a little more aggressive. I mean, this three-phased approach seems like it's going to take forever in some respects, and some of these businesses don't have forever because every day they're not working is a day that they're not being able to pay bills. They're not, it's just a cascading effect. So I think that's the sense of urgency we feel from a business perspective.
No, I hear you on that. How do you think things are going in the business community with making these kinds of modifications, the ones that I talked about, the ones that we're starting to see in other states that are reopening? There is a lot of nervousness in many of those states that the businesses didn't have enough time to prepare. They didn't have the resources to prepare. They didn't know exactly what they should be doing. Do you feel like that's on a good trajectory in North Carolina? Is there ways that businesses could work more closely with the states or look at these other experiences to be ready and to help this succeed and move forward quickly?
Yeah. I think a lot of businesses have adapted well. Technology is a great thing. I think a lot of our businesses in North Carolina have great technology. They have great abilities to work remotely. So they've been able to, move their workforces out of the offices and be as productive perhaps as they've always been. Our business is a good example. We have roughly 200 employees. We've got a good technology platform. We only have 2 people in the office. The rest are working remotely. And fortunately, we've been able to conduct our business in a reasonably good way. I worry more about, the retailers, restaurants, those people who are much more dependent upon walk-in traffic, foot traffic, things like that. And it's very difficult for them to work in remote settings. A good friend of mine runs a restaurant, and he told me that a restaurant can shut down for the percentage of restaurants that can shut down for 30 days and survive is about 70%, 75%. If you were shut down for 60 days, only 60% of restaurants can survive. And if you're shut down for 90 days, only 25% can survive. So that worries me long term, because many people in our state have their whole livelihoods tied up in those businesses. And without the ability to open, then their whole livelihoods and their whole value and their net worths are at stake, and it's just devastating for them.
Yeah, it is a real challenge, especially for restaurants that really need people in there in order to get back towards their old levels of economic activity. And again, that's not going to be at 100%. It's going to, there's going to be more spacing requirements and so forth. And for people, I think, to be confident to go back out and to start doing those things again, they're going to need to see some real changes that these, I think consumers are going to expect more distancing to be observed, et cetera. And that does seem like some extra work for businesses at a time when they're already strained. Are there some more things that the state could do, or that we could do together to help them with this reopening process? Again, you want it to happen as soon as safe, but help it go smoothly.
I think that's reasonable. I think two things. One is, I think, trust business. I think there's this perception, I think, among the business community that everything has to be, decided at a state level or a government level and then pushed out to us. And I think what we have is we have a lot of smart people who are very clever about figuring out problems. They are problem solvers by nature. And so I think first and foremost, I would say trust business. I think many of us are prepared and willing to really try to be clever and do the right things. I think secondly, do publish good ideas. I mean, guidelines are very helpful. I mean, staying 6 feet apart. I mean, most of us don't have access to medical tech, experts or, medical folks who can give us guidance. So publishing guidelines, I think, is a very appropriate thing for the government to do. Accumulating best practices like the chamber is doing. That's another positive thing I think that businesses can look for. But I think the big issue is to give businesses tools. I mean, if you just give us the tools and the guidance, then I think you have to have a level of trust that we're going to do the right thing, because the most valuable, I hate to, it's too much of a cliche, but the most valuable asset that we have are our coworkers. And the last thing we want to do is see them, fall prey to this virus. And so I think that's the big message I would just say is, we're eager in the business community to be partners with, decision makers.
I would say that in some of the states that have reopened, I talked about Texas a bit, having this extensive and close partnership between state leaders and public health, the public health experts, the physicians, and the businesses was really helpful for the state, where some of the businesses in the state did like you said, they had some first ideas about what they thought might work, and they had a process for getting feedback from state leaders and especially public health leaders on, well, that's not exactly in line with what we've seen in the evidence on transmitting COVID-19, or not exactly in line with CDC guidance. So, how do we work it out? And that kind of collaborative process, which engages businesses, also helps get them more familiar with what's really going to be required, I think has been very helpful in many parts of the country.
Another thing I think we all worry about in the business community is that it seems like for the last 30 days, the only disease that we've talked about is COVID. And we know that there are other diseases, as you pointed out, that are prevalent among our coworkers and our neighbors and our friends. One of the biggest issues that I think we all worry about is mental health, and the stress levels that we see families under these days, and folks that are unable to move, those kind of things. So, I think giving guidance on dealing with sort of mental health issues would be something businesses would need to do. I mean, all of us, at least most of us with some size to us, we have, wellness programs, we have some programs that could address that, but helping us figure out the mental aspects of this, I think would be very important as well.
Yeah, and I think in connecting people, the workers, others, making sure they know their resources they can use. Many of you are in health plans like Blue Cross that have massively increased their support for telemedicine, including telehealth to support social service needs, people who are struggling to find food or other basic necessities, as well as people who have more mental health needs. And that is going to be one of the, there's some positives coming out of this. I don't think we're going to go back to the way we were on medical care, where if you needed any kind of service, you had to get all the way over to the office and park and deal with all of that. when in fact a lot of these services can be provided quite well via video calls or even phone calls for people who don't have broadband. So hopefully that kind of connection, which businesses can definitely support between their employee needs and easier ways of meeting those needs, even here in the pandemic, can be a part of moving forward productively from these really tough situations that we're living through from a mental health standpoint. And Dale, there's also add on in terms of reopening. If you look around the country, among the first parts of reopening the economy is reopening more of the healthcare services. So more of the elective procedures that people, that aren't just purely voluntary or cosmetic, but important procedures they've had to put off because of the worries about risk of transmission. When our healthcare organizations can say, we got this, we've got enough capacity to handle the surge, and we're also starting to do the regular kinds of medical services that can't be done by telemedicine. That's something that I think could start happening more right away. Some of that's happening already here in the state, and it's a good way to take a step forward on towards a broader reopening. Make sure we've got our healthcare system there for people, not just for their COVID-19 needs, but for their other needs as well.
Yeah, maybe the last topic we'll talk about, and then we'll open it up for questions. But we've heard a little bit about the idea that this thing could spike again in the fall.
Yeah.
And I would just encourage thought leaders to be thinking about that now. Hopefully we're learning things as we go. I mean, somebody described this as we're changing the tires on a moving car. I get that,
Yeah.
but thinking ahead now, if that were to reemerge, what are we learning today that will be helpful to us in the fall? That would be something very important, I think, for us to consider.
I think that's a really important point. And we're not only like changing the tires on the car, we're like building a vehicle that we've never had before, in terms of this strong collaboration between business and between healthcare and between our local public health and state public health programs. We need that to work well together to identify people who are at risk. So employers are going to have some early indications if some of their employees are sick with some of the screening they do and so forth. That'll help get these public health protections in place, help with testing and tracing, making it easy to refer people to testing. Like you said, you care about your employees and you want them to avoid any complications from the infection. Being part of this new network that we're building to prevent spread of infections. Dale, I do worry about another big wave in the fall, but I think what we're more likely to see around the country is we're not going to eliminate this virus. There's going to be a steady level of, or some level of viral activity out there. And so we're probably going to see outbreaks here and there. Hopefully we'll get a handle on preventing them in these highest risk settings like nursing homes and assisted living facilities. That's to be up there among very top priorities in the short term. But they'll probably happen in other places too. And if we can get good at preventing or limiting those small outbreaks, that'll be a really good sign that we'll be in better shape for the fall. And then with a little bit of luck on the medical treatments, as I said, we're starting to see some progress. That's going to take the edge off the pandemic as well. So hopefully could be another big wave in the fall. I'd be more worried about the smaller outbreaks that can occur in the meantime. If we can contain those, we'll be in a much better position for the fall and hopefully have a much stronger state going forward between business, healthcare, and public health, all working together to prevent risks of further health problems in our communities.
Yeah. Okay. Well, why don't we see if the questions have arisen from the audience then?
Thank you. Can you hear me okay?
We can.
Yes, Janelle.
Wonderful. Thank you. This first question is for Mark. Do you know of any research around the other effects of the virus and the shutdown? There have been mental, social, and emotional ramifications that seem to be impacting more people than the virus itself.
Yeah, no question. Those impacts have been large. Unfortunately, research usually takes a little bit of time to do, but we have some early indicators and they're all kind of worrisome. So obviously a lot of healthcare that people were getting before, they haven't been getting. And excuse me, some of that has been replaced by very rapid growth in telemedicine and telehealth. And again, I think that's a good trend, and for treatments and care that people can get while staying at home, that's just good for everybody. It's more convenient, it's less costly, it's safer for people who are in these higher risk categories. So we're seeing a big response there, and it's hopefully something that the business community in North Carolina will insist that we keep as we move through and beyond the pandemic. Areas that are more worrisome is, it's probably okay that some people aren't getting as much elective surgery, but we're also seeing declines in hospitalizations for strokes, for heart attacks, for things that you wouldn't expect to see or want to see a decline in. And that may be because these are perhaps milder cases, but they are real danger signs that important access to care isn't happening. And we're also starting to see some evidence that not only is COVID-19 having a bigger impact in our lower income, more vulnerable populations, but these other health problems and access problems are too. So there's a lot of evidence, growing evidence of serious issues there. We already talked about the increased prevalence of mental health problems and social problems like lack of access to food or community that can contribute to the mental health and other medical problems. Those are very real. Unfortunately, it's not like you can just open everything back up and make those go away. If we have a reopening and there's a big resurgence in cases, or if people are afraid to go back out and start doing things in a more normal way, because there are big outbreaks, you're still going to see those problems, and they might even be exacerbated. So very serious issues, and ones that I hope we can account for as we take the steps that we've talked about today.
Thank you. Thank you for that. We'll take one final question. I know we are after the time, but as testing increases, how will we know we are seeing a reduction in cases?
Well, so as testing increases now, I wouldn't be surprised. I think this was implicit in the question, if the number of cases detected goes up. By some of the studies that have been done looking at whether people in a community have developed antibodies to COVID-19, meaning they had a prior infection, looks like the prevalence of COVID-19 maybe 5 times, and some communities maybe 10 times as much as we've measured. So we may well see some additional cases. That's okay. Other things I would carefully watch. What we shouldn't see is big increases in hospitalizations or deaths, because if it's just mild cases that we're detecting, those wouldn't have ended up in the hospital anyway. And by detecting those mild cases, we can do that containment. We can do the contact tracing and prevent the spread of more cases. So what we should be seeing for sure is holding steady and hopefully continuing to reduce hospitalizations. That has not happened yet in parts of North Carolina, and certainly reducing the deaths. But we may well see some additional cases as part of increased testing. Doesn't mean that testing is bad. We really need to get it in place so we can get a handle on what's actually going on in our communities and make much more informed decisions about businesses. If we end up finding that we can detect most of the new cases and contain them quickly, if we learn more that there's not that much of a viral activity in a community, that'll give us a lot more confidence and give the public a lot more confidence about taking further steps in reopening.
Thank you, Mark. Okay. Well, thank you all for attending today's presentation on North Carolina's Road to Reopening, Aligning Health Policy and Business. We hope you found today's content valuable. You will receive a brief survey of the webinar via email. We would appreciate any feedback you can provide to allow us to improve these sessions. Again, the recording of today's webinar and any slides will be made available to you via email within 24 hours of the webinar. Thank you all. Stay safe and healthy during this time. Thank you, Mark and Dale.
Thank you all.
Have a great day, everyone.